These bean-shaped organs called the kidneys are very vital to health, and taking care of this organ is important, but it's more important to pay close attention to your kidneys if you have conditions like diabetes, hypertension, liver disease, obesity, autoimmune disease, and so many others. And there are a number of common supplements on the market that can potentially hurt your kidney. I'm going to share 10 of them with you. So let's get started. Number one is Liquorice Wood Supplement. It is beneficial for infections, cough, and then GIT issues. But surprisingly, it raises blood pressure. And I've seen some drugs for erectile dysfunction containing licorice roots. And that's how many of these aphrodisiacs work. They increase blood pressure to increase blood flow to the penis for erection. But the active ingredient called glycyrrhizin is the kidney irritant, mainly through the effect on blood pressure by suppressing renin activity. Renin is that hormone that helps you regulate and control blood pressure. It also leads to what we call hypokalaemia, that is low levels of potassium, all of which affects your blood pressure going high. So your blood circulation will be affected to the kidneys, and that will lead to what we call acute kidney injury, which can also lead to what we call chronic kidney damage. So this is something you have to be on the lookout for if you are taking licorice supplements or you are taking any product that contains licorice roots. Number two is Aloe Vera Supplement. I'm sure this is a surprise one for you because it is quite popular. It is used for the management of glaucoma, liver fibrosis, type 2 diabetes, flu, and then psoriasis, which is a very common skin condition. But the side effects include diarrhea, low potassium, which is not something good because we need this electrolyte to manage and lower high blood pressure. It also leads to kidney failure with long-term use. So as a precaution, you should be monitoring your kidney function parameters if you are taking Aloe Vera Supplement for a particular condition to stay in top shape with your kidneys. Otherwise, it is better to stay away from Aloe Vera Supplements. And it is very important, especially for those with some level of chronic kidney disease. But if you are taking the raw aloe vera juice and applying topically on your skin for a skin condition, that is fine. Number three is Potassium Supplement. This is particularly harmful for people with kidney disease because the kidneys are really bad at excreting potassium if you already have a kidney disease. So potassium level is going to be very high if you check your kidney chemistry. So taking potassium on top can be very hard on the kidneys. Number four is Stinging Nettle Supplement. If you ever come across this plant or herb, you will understand why the name Stinging Nettle, because it stings when you touch it. It's very irritating to the skin. And one dosage form is the tea or the pills. It is used for painful muscles and joints, eczema, gout, tension relief, and anemia. And I can assure you, if you rub this herb on any part of your body where there's some form of pain, that pain will go away within minutes. It is very useful. But the trouble is when you take it orally, it can cause acute or progressive kidney injury. So if you are using Stinging Nettle, please be on the lookout for your kidney function parameters. If there's any deterioration with the result, avoid taking this immediately. Number five is Yohimbine Supplement. It is good for fat burning for weight loss, erectile dysfunction, and exercise performance, and also neuropathy. However, there are reports that it can induce progressive renal failure. So be on the lookout for your kidney function parameters. Then number six, which is quite popular, is Creatine Supplement. This can potentially hurt your kidney and is very popular among bodybuilders who are looking to build those biceps, looking manly like Hercules, and even for athletes who want to improve on their muscle strength and performance. The trouble is when it is combined with a high protein diet, which most bodybuilders and athletes do, that is the part of it. It can cause kidney injury. This will be a recipe for kidney injury, like what we call acute tubular necrosis, where there's shortage of oxygen and blood flow to the kidneys. And if it is identified earlier, especially in young persons, you can reverse this condition. So the point is, if you are using creatine supplements and at the same time eating a high protein diet, then of course you increase your risk of potential kidney damage. And even higher doses of creatine supplement may also cause kidney damage and increase the risk of kidney stones. This is because creatine can increase the production of waste products in the body, which may overload the kidneys. So that is very important. Number seven is Chromium Picolinate. It is good for blood sugars, cholesterol, and also weight loss. But however, some side effects include liver damage, headache, anemia, and particularly it can lead to renal failure if you have any kidney disease. So be on the lookout for that product. If you have any kidney disease, I wouldn't recommend you go for Chromium Picolinate. Number 8 is high doses of vitamin C. Emphasis on high dose. Although vitamin C is an essential nutrient for many body functions, excessive amount of vitamin C supplement may increase the risk of kidney stones. This is because vitamin C can be converted into oxalate, a substance that can combine with calcium to form kidney stones in your kidney. Several reports exist documenting high doses of vitamin C, about 60 grams per day, causing oxalate kidney stones that can deposit in the renal tubules and cause damage. Fortunately, the renal failure is reversible with dialysis and then supportive care. Also, there are types of vitamin C that you need to know. And to figure out the types you are using, whether it is synthetic or natural, check the label. Natural supplements usually list food sources or are labeled as 100% plant or animal based. Supplement that list nutrients individually, like vitamin C, or use chemical names like ascorbic acid, are almost certainly synthetic. Avoid those ones. Then number 9 on the list is wormwood oils used in tinctures for muscle pains and joint. However, there has been some reports that it has shown or to cause renal failure for those with a kidney disease. So always be on the lookout for your kidney function test and other parameters if you are taking wormwood oils. And lastly, we have the NSAIDs and the antibiotics. Now, these are not supplements, but I just added because of the abuse of painkillers and then antibiotics. Long-term abuse of this medication will definitely damage your kidneys in the long run if you abuse them. So always seek medical advice before attempting to use any painkiller or antibiotics. So these are some of the common supplements that can harm your kidney. And I'll see you in the next video right up here. Always remember that God wants you healthy. Your health, your life. Thanks for watching.